There only.
Here only. Okay, okay. Then we'll see in this short meeting one more important term related to homeopathic materia medica, and that is it's suited to or adaptability. And this is a very popular term used in the Allen's keynote. And there are so many lovers of Allen's keynote. There are so many. I know the various homeopathic students, homeopathic physicians. They practically know. They can practically remember each and every word of this Allen's keynote, and they are very much giving importance to this term, suited to and adaptability. Now, suited to means what? The remedy suits to. So it is a one phrase. This remedy suits to this. This remedy suits to this. And sometimes the word is used as adaptability. Then adaptability means what? This remedy is adapted to what type of individual? That is the basically common meaning of this both term. Suited to and adaptability indicates that these remedies are more applicable to which types of person, and it just summarized the clinical verified use of a remedy to the different individuals, and usually it includes various points. It sometimes includes diathesis, it sometimes includes constitution, it sometimes includes stage of life, it sometimes includes stage of disease. So I'm don't fear about these terms, diathesis, constitution. I will take in detail about these two terms. So stage of life means, so there are various stages of life. So if we see a life of any human being, initially there is a infant stage, then adolescent, then first is infant, then child, then adolescent, and then middle aged, then fully
The
developed adult.
teenager, adolescent, and then adulthood again.
Okay, okay. So you just remember the chronology: infancy to old age. There are various stages of life, and according to Allen, H.C. Allen, few remedies are indicated in infants. Few remedies are better indicated in children. Few remedies are indicated in the old age. So that is the various stages of life. Then stages of disease. So whenever there is an evolution of disease, every disease has its stages. For example, if you take simple coryza, there are certain symptoms, premonitory symptoms, like there is some kind of uneasiness, and then there is a development of throat pain, then there is a development of sneezing coryza, and then finally the profuse discharges starts from the nose. So this term suited to adaptability refers to also various stages of disease, and this term suited to adaptability is very important for the persons who are studying the materia medica with the help of Allen's keynote, because it just summarizes the essence of a remedy in a very few lines. So essence, I have explained you essence, nothing but the image, sick image of that person in a very few lines, in a very few important word, the lines which begins with this terms suited to adaptability. It beautifully summarizes the essence of that specific remedy. And if you remember the few lines, you can remember the whole remedy. And these are usually the important keynotes indicating the wrap of fiber running throughout the remedy. Now, what is this wrap of fiber? So this term is taken from the preface of Allen's keynote. Then if you see any rope or any rope, any wire rope, there is a one central part of that rope or fiber, and the various other fibers are just clinging around those main important fiber, and there is a construction of a फाइबर. सो रैप ऑफ फाइबर यानी कि जो जो भी एक रोप होता है या फिर जो भी एक क्या बोलेंगे उसको, डोरी, उसका एक बीच का हिस्सा जिसके इर्द गिर्द में सारे के सारे जो फाइबर्स होते हैं वो एक दूसरे से यूनाइटेड होते हैं, एंड दिस that is a wrap of fiber, and this wrap of fiber is applied to the homeopathic materia medica when there is something very peculiar, something very common which is running throughout the remedy. Now we'll take few examples of this adaptability. So first example is Dulcamara. It's a remedy, and Allen's keynote H.C. Allen beautifully summarizes the essence of this remedy. It is adapted to the persons of phlegmatic, scrofulous constitution, restless and irritable. So what does it mean? That if you study the symptoms of Dulcamara, there will be this phlegmatic, scrofulous constitution. Now phlegmatic means it is related to the mucous membrane. Scrofulous means related to the glands. And when you study Dulcamara, you will find out in various different parts of the body in under Dulcamara, there are discharges, there are watery discharges, there are sticky discharges, and it is all summarized in this word phlegmatic. Then scrofulous means related with gland. There are various complaints of gland in the Dulcamara, and this is the essence of that Dulcamara. That is, it is more useful to the persons who are having this phlegmatic scrofulous constitution, and then it also indicates the adapted to the persons who are restless and irritable. So just two words, and the whole Dulcamara materia medica is in front of us. This is the beauty of Allen's keynote. Then we'll see one more example, Magmur. So in the Dulcamara, what was emphasized is constitution and few mental symptoms. Then in the Magmur, we read it is Magmur. Allen writes, S.C. Allen writes, especially adapted to diseases of women. So it is a very good remedy for the various diseases of women. Now, what are the diseases of women? It means there are various diseases related to the female genitourinary tract or female genital tract. Either it will be diseases of uterus, it will be diseases of ovaries, it will be diseases of vagina, it may be diseases of fallopian tube. So the Magmur is adapted. The Magmur is more clinically useful to various diseases of women. So, and then he further writes, it is what type of diseases of women. So diseases of women which are spasmodic and hysterical complaints complicated with uterine diseases. Then further writes, it is also adapted to the women who have suffered for years from attacks of indigestion or biliousness. So when we read carefully this three lines, we come to know that Magmur is a remedy which acts on the woman, which acts on the female genitourinary tract, and in that again the various types of spasmodic complaints, various types of hysterical complaints, and this diseases of woman will be complicated with some kind of uterine disease, and this person or this patient of Magmur will have a history of indigestion or biliousness. Then few more example I have given, muriatic acid, lactic acid, silicea. You can read it and understand it, how in a few lines with the help of this diathesis, constitution, temperament, important mental symptoms, how Dr. S.C. Allen is able to give a very concise picture of a remedy in front of us. So this is the meaning of this term, suited to adaptability and its example. recitation of this particular term. It is same as that of sphere of action. It is same as that of therapeutics and clinical. So I will not go into the details because we are running short of time. But you just go through the slides that this term suited to adaptability. Once you know that this remedy is adapted to the diseases of women, you don't have to mug up the whole symptoms related to female genitourinary tract. There are symptoms of menses, there will be symptoms of euphoria, there will be symptoms related to collapse of uterus. It will aid in the comparative study. It will also help in the final differentiation of remedies. Just to highlight this Dulcamaram, phlegmatic scrofulous constitution. So there are also other remedies like Calibicromica, like Pulsatilla, having the same phlegmatic scrofulous constitution. But the two words which was there in front of Dulcamaram, restless and irritable. You can recollect in front of Dulcamara it was written adapted to persons of phlegmatic scrofulous constitution, restless and irritable. So for this scrofulous phlegmatic constitution, two more remedies are there, Calibicromica and Pulsatilla. But these other remedies are not that much restless, not that much irritable. Pulsatilla is a very slow acting medicine, very slow motions and weeping. And in case of Calibicromicum, the discharges will be more sticky. The Calibicromicum will be more dictatorial persons, more focusing on the family. So it does also helps in the final differentiation, and we have also understood how this adaptability is derived. It is again the same process, and it belongs to the second and third phase of evolution of materia medica. The same limitations are also there to this adaptability. It is not the information which is directly given by the prover. It is the indirect information from retrospective analysis of drug proving, and it also adds into the clinical verification. So there is also chances of prejudices. So just to give the example of Magmore, Magmore is, when we read this Magmore adaptability, everything is related with diseases of women. But Magmore also, at the same time, it is a very good remedy for trigeminal neuralgia. It is a very good remedy for acne, pimples, which is aggravated before menses. So there are certain chances of prejudice also that we will have to also keep in our mind and use these two terms judicially, rationally for the study of homeopathic materia medica. But no doubt these two terms are very, very useful for the study of materia medica.